The Congressional Budget Office this week estimated that under the Obamacare replacement bill, 14 million more people would be uninsured by next year than if the current law remained in place. The bill faces stiff opposition from Democrats as well as some conservative Republicans who have expressed serious doubts about the latest version of the health care overhaul. The bill is scheduled for a House vote on Thursday. Margot Sanger-Katz, who covers health care for the New York Times, joins us now. Good morning, Margot.
Good morning.
So let's first talk about what the changes may be to this bill, because House Speaker Paul Ryan has said there will be changes, which is a pivot from his initial position that there would be no changes. What can we expect in the coming days?
It's a little bit hard to predict. There have been some discussions in the House about some provisions that real conservatives want to make the bill a little bit more in line with their vision. So there were two that were discussed yesterday that may become part of the bill. One that would require some Medicaid beneficiaries to work or to show that they're looking for work in order to qualify for benefits. And another one that would give states the opportunity to use their Medicaid funding in a different way, to essentially get a big block of money and then be able to direct that to whatever programs they wanted for their Medicaid population, as opposed to the kind of default proposal under this bill that would give the funding to states on a per capita basis, depending on how many people were signed up.
Margaret, the Congressional Budget Office estimates that 24 million more people would be uninsured by 2026 under this plan, and many of those losses would come from Medicaid enrollment. How does this plan, and I know this is still in negotiating stages, but how is this going to affect Medicaid?
It will affect Medicaid pretty substantially, and in two separate ways. I think some of the discussion kind of mixes these together, but Obamacare expanded Medicaid to a new population of people who really just never were eligible for government health insurance before. And those are people who are relatively poor, but who don't have children. So if you're a single adult and you have a really low income, you used to not have a lot of good options for getting health insurance. And what Obamacare did is, in most states, it expanded Medicaid to cover those people. This bill would basically wind back a lot of the federal funding that made that expansion possible. And so what the CBO estimates is that a lot of states, in the face of those kinds of cuts, may decide to stop covering the people that they were added as part of this new program.
But Margot, that seems politically risky for this president, right? I mean, there are a lot of Republican governors who have overseen Medicaid expansion who are unhappy with the unwinding, as you call it. And there are also Trump supporters that would be greatly affected by that change.
Yeah, absolutely. I mean, these have been very large increases in health insurance among people who really didn't have options before, and they have sort of disproportionately fallen actually into Republican states that have expanded Medicaid. So if you think about states like Kentucky, Arkansas, West Virginia, those are places where just hundreds of thousands of people have signed up for these new benefits. And if that funding for that program goes away, the expectation is that a lot of those people would return to being uninsured.
Margot, the president said again yesterday that Obamacare is in a death spiral. Is it?
It's not really. A death spiral actually is this very technical term that actuaries use to describe a completely failing insurance market. And the idea is that prices get higher, and what that means is that healthy people can't afford insurance, and then only sick people sign up, and then prices get higher again, and it kind of spirals in this negative way. We have seen in this last year some difficulties in the Obamacare markets around the country where prices have gotten higher by an average of 22%, and some commercial insurers that were offering insurance there in the past have decided that they just don't want to stick around. But overall, I think there are some signs that things are settling down and that there's a possibility of these markets getting stable in the long run.
Right,
and the CBO in its report said that too.
All right, Margot Sanger-Katz, thank you so much for being with us this morning.
Oh, sure.